I rang 111, something that I frequently do because we have many health problems. And I spoke over the phone, name, dress, what's happened, and within half an hour a young man arrived.
Outside of normal GP office hours, patients who are too unwell or too frail to be able to get to an out-of-hours assessment centre will be visited at home by an out-of-hours clinician. Now, these patients are not very well known to the clinician. Often they've never met them before. They're often more unwell than the average patient who would see a GP, and that means that the decisions that clinician is trying to make are really quite tricky. We thought that providing these clinicians with immediate results to common blood tests would help them to improve the way that they diagnosed illnesses and improve the decisions they made about whether patients needed to be kept at home or whether they needed to go into hospital.
Being able to pull out of your bag effectively a hospital laboratory is a huge advance. It's a great diagnostic technological advance and allows us to do things we couldn't really do in the home otherwise. The ability to understand what's wrong in the own home is really critical.
Point of care blood testing is very helpful for any healthcare environment. Within Oxford Health, it's already used widely within the emergency multidisciplinary units and within the hospital at home service.
You have to engage the clinicians to make sure that they're fully on board with what is available to them. Lots of the clinicians have said years ago they didn't have SATS machines. Now they wouldn't think twice about not having a SATS machine available to them within their clinical assessment, and they all anticipate that point of care will be part of their diagnostics. They will use it on a routine basis.
He did the usual observations, blood pressure with the cuff, and Brian passed all that, and that's when he introduced this machine. And this machine would allow him to know within 10 minutes Brian's full blood count.
If you're on the cusp of deciding whether somebody needs to be admitted or not, then the point of care blood test actually can help you make that final decision. It's not the be all and end all for everything. Clinical judgment absolutely is important, but it's another addition to your clinical decision making which could really help.
He attached it and put a kind of cannula in, and then he said, "That's it, just sit and relax, and we'll have the results." And the results came out in about 5 minutes.
From start to finish, I think the average reported testing time was 7 minutes. So the machine actually gives you a result within sort of 90 seconds. It doesn't actually take clinicians that long. The difficulty that we found was that it was regards to the confidence, and actually if clinicians were not that familiar with the machine, they would have to just double check what they were doing with the SOP and with the process. So that delayed things slightly, but those who were used to using machines like that and had used it a few times, it took 3 minutes.
By being much more accurate about which patients need to be referred and which patients are safer to be managed at home, then this reduces the need for follow-up assessments if patients have deteriorated after initial assessment without those blood tests. For the hospital providers, it's better for them because they have much more information about patients on transit before they arrive at the hospital. And that means that the patient's time in the hospital is less, and that makes the hospital more efficient.
He said, "This is a good result. You don't need to go to the hospital. How do you feel now?" Brian said, "I feel fine." And I went, "Oh, thank you so much. This is so wonderful."
It saved a trip into the A&E in the middle of the night or the early morning, and ambulance call each direction.
We had a clinician who had tried to use it once and failed, and so her confidence was sort of a little bit low. She was a bit like, "Oh, it's a bit fiddly, I'm not sure that I'm actually going to use it in the future." And then when she did use it and it was successful and it did influence her decision, she then felt very positive about the whole experience and came back and told all of her colleagues. It's a word of mouth culture change for the clinicians as well.
Any way in which we can make ourselves more efficient is going to be really critical to future-proof our health and social care system. And our ability to do that, I think, is going to be really unleashed by point-of-care technology. And so this study has really been the first one to try and move into that ground, to take the hospital laboratory into the patient's home, give it to the fingertips of the doctors who are seeing the patients at the first time in the community as a way to sort of test how do we future-proof our health and social care system.
These tests were used in home visits by clinicians. They weren't used quite as frequently as we'd expected, but in the centre that performed best, 3% of the home visits used a blood test. In about 60% of the times when these tests were used, the patient was able to stay at home. And you could argue that since a blood test was part of that decision, they otherwise might have needed to go to hospital. We found that clinicians and patients really responded positively to these tests when they were used. There were lots of benefits. Patients were very happy that this had allowed decisions to be made more quickly, and clinicians were happy that they'd either had some support in their decision this patient needed to be admitted, or they'd felt confident to leave them in their own home.
It saves
A lot of money.
a lot of money, a lot of unnecessary going to and fro. It will make a significant difference to the workload of the NHS.
Yes.
I think my top tips for other research teams wanting to do a similar type of project is firstly, build a really good team between people who are on the ground and putting these things into practice and people who are experienced in evaluating these types of interventions. The second thing would be to make sure that you've got really good buy-in from the clinicians who are doing the project.
You put your patient at ease. Doctors are used to talking to people when they come. They can assess what's happening, and they know that in their bag they've got a machine that is going to help them find out what's happening.
Technology is advancing all the time. I learnt to fly on a Tiger Moth and to drive on an old Ford Y-type. Now your cars and your aircraft are completely different and so much better. And it's a very conservative with a small c attitude to look back.